Allô, Nissan? Hey, grosse tempête, hein?
Hey, Karine, oui, je sais, les vilains bonhommes de neige sont de retour.
Mais avec le Nissan Rogue à traction intégrale, c'est pas stressant.
Exact, il est conçu et testé pour nos hivers. Oh, Karine, il y a un bonhomme dans le Rogue.
Ah, c'est correct. J'ai allumé les sièges chauffants.
Ah, bien joué, Karine. Maîtrisez toutes les conditions. Louez le Rogue S 2026 à partir de 0,4% jusqu'à 36 mois, incluant une réduction fidélité de 0,5% pour les clients Nissan admissibles. Jusqu'au 2 mars, sur approbation de crédit, les conditions s'appliquent. Détails chez Nissan.
Dr. Horacio Arruda is Quebec's Director of Public Health and has become the face of the province's fight against COVID-19. It's our pleasure to welcome him onto the program. Dr. Arruda, thank you for joining us.
It's a pleasure.
So,
have a nice day.
Yes, it's a beautiful day out there. A lot of Quebecers want to get outside. A lot of Quebecers thinking about getting to regular activities. So with that in mind, I have a few questions for you off the top here that I think a lot of our listeners are wondering. Yesterday, you announced some new rules for gatherings, 50 people or less. And we're getting some questions here about just what Quebecers can do. So right now, with this new regulation that comes into effect on the June 22nd, could someone have a wedding with 50 people or less?
Yes, but there's going to be some rules for that. In fact, people will need to be keeping, I would say, as they are going to be in a wedding, they're going to be, I would say, some families that could be together. But in between families, there is absolutely necessity to have a 2 meters distance, because it's a way that inside of a place you can be 50. We will recommend people that will go through going there to use masks and have good hygiene and everything like that. There is going to be a need for the sanitary places to be washed often because there is a lot of people that are going to be using them. But the people could be, I would say, families, as we told, could be together because they come from the same place in a table, but we don't want them to be mixing up with everybody they are not with. And I would say there's going to be a need to keep in between the tables at least 2 meters, as it will be in a restaurant.
So what you're saying is as long as you can respect the other social distancing guidelines, like the 2 meters between different households, you could have that small wedding, 50 people at an inside venue, and that would be okay.
Yes.
Does the same apply for, let's say, a funeral or a family reunion?
That would be applying, I would say, in the private sector. We are at home. We are still with 10 persons and 3 families and 2 meters. But if you're talking about a funeral place, if there is, I would say, those numbers under the capacity of distanciation of 2 meters, that will be okay. But at the same time, we should understand that funerals and weddings are the one factors more at risk because it's difficult sometimes to not get in touch or in contact with others to share the pain or the joy of the marriage. So it's why people must respect that. And especially if you're a old person or with a big chronic disease, the best recommendation would be perhaps to avoid those things. But we let that to the judgment of the person.
All right. So you can do it, but proceed with caution. I love that you bring up judgment here because I guess your job is a lot of judgment calls. I spoke with a bar owner earlier this week on this program. He's unhappy, of course, because the bars are not allowed to open. He brought up the fact that a topless dancer location, like les danseuses nues, down the street, they're allowed to open because they have a food license. And he says it doesn't make sense. What do you have to say about those judgment calls you have to make where it may not make sense to people? Oh my God, they can open, but this other place can't open. How do you make those calls?
The problem is on details and even the planification. We are taking decisions based on the volumetry of the people, based on the different settings, based on the different risk factors that could happen, and we work that with the industries, with the SNEST, which is the Commission of Work, to want to protect, I would say, at the same time, the clients and the workers. So, and it's very difficult. I understand those, I would say, nonsense situations that could happen to those big rules. But soon, I would say, we will go through another process, which will be no more saying what is permitted, but saying what is not permitted. And with this, I think that all those sectors who we must open in a different way, because that's the same thing, is that we cannot do bars the same way it was before because of the distanciation that is needed and everything. But if people will respect those rules soon, I would say most of the activities under society will reopen, but in a different way. But there's going to be some big exceptions, like big, I would say, crowding of people, even in parks and everything, because those situations are at higher risk of transmission.
We're with Dr. Horacio Arruda, Quebec's Director of Public Health. Dr. Arruda, the Education Minister, announcing the details of kids and students going back to school in the fall. What do you say to parents who are still worried about sending their children back to school?
Okay, the good news is that kids have no much impact of the disease. It doesn't mean that it cannot happen, but most of the cases are, I would say, with low syndrome, or I would say like a cold or like a flu, and most even sometimes are really asymptomatic. And they are not, I would say, a vector for transmission as they are for other virus, respiratory virus or influenza. So that's the good news. And based on the experience we've done outside of Montreal, and based on what has been done elsewhere in the world, France, different countries, Belgium, European countries, we can now go to, I would say, the impact of not having school is very bad comparing to the risk they are going to have if they go to school. And we will permit, I would say, a different way than before, but there's going to be stimulation for kids. I think it's very important, and we cannot keep kids away from school for a long time.
Dr. Arruda, talk about those concerns you have, because it seems like throughout this crisis, you pay particular attention to not just the COVID-19 physical issues with this pandemic, but also the other issues, the mental health and all of those other things. What worries you the most at a time like right now when it comes to COVID-19, aside from the physical COVID-19 problems?
I think that's the capacity of mental health. You know, if we cannot confine people for months, and if we don't deconfine, there's going to be, I would say, a deconfination made by people in an anarchic way. Now we are organizing those things. We are opening things in a different way. So I think that, there is a big problem even for elderly people if they are not stimulated, if they don't walk, if they don't have access to outside, they get depressed, they get mental health issues. And that's the same thing for kids. That's the same thing for adolescents. Socialization is a very important part of being a good, I would say, citizen later. So if we don't do that, and the pediatricians can tell you, there is a lot of issues related to kids not going to school. School is protecting, getting outside is protecting poor kids who don't have access to food, who are in families with violence and everything. So I think it's important, the disease, but especially with kids, as they have not much impact of this disease, it's better that we let them go back to a more normal way.
Dr. Arruda, we got a note from a listener, and their husband diagnosed with cancer 2 months ago, and they still have not had treatment. The hospital's saying, we're going to call you 2-3 weeks to start this. Of course, 3 months, if you end up 3 months without any treatment starting, it causes a lot of anxiety. What is going to be done for all of those people that have had other treatments delayed?
I understand. I think actually we are reopening those things. We want to I would say, treat the backlog that has been done with the healthcare. And I would suggest that person to contact his doctor or to make sure that he can get access to the treatment that he needs. And that's the fact. And we are doing we did the emergencies, the more emergencies, but now we're going back to, I would say, a more normal life to care. And I will say also, people don't be afraid of getting care because of COVID-19. If you need to see your doctor, if you need to see your specialist, If you need to go to the hospital, let's go.
Dr. Arruda, do you have any regrets over the last 4 months? Things that if you could go back, you'd do differently?
I would say not in the last 4 months, but probably in the last years. It's all related to the way we manage our longer-term care facilities. The way that there was not enough staff in those things, because this was a crisis. I would say that's a drama. It was, for me, very difficult to see all those elderly people dying because of, I would say, different factors, but also one big systemic one, which was the not enough staff in those, and even before. So for me, that's probably the thing that I regret the most. It's not only on the last 4 months.
And are we prepared for a second wave? With that in mind, are we prepared for the fall and perhaps a second wave?
We're going to do our best. I can tell you that we will look at everything that was not perfect, or I would say which was fragile, and try to make better. Will it be easy? I don't think so. I don't think that it's going to be a smooth operation, because this virus, we don't know. It depends how it's going to be attacking, what will be the level of second wave. Mm-hmm. But, it was a terrible story, those stories of health care facilities for elderly people. But in the community, we had a success. This big stopping make us not having the same problem that happens in Italy and France and other places, where you have to choose between two persons for the intensive care, which didn't happen in Quebec. And I hope it will never happen here.
Dr. Horacio Arruda, Quebec's Director of Public Health, thanks so much for coming on the show.
Thank you, and have a nice summer. Don't forget to continue to have good distanciation and hygiene, and cover with a mask.
Absolutely. Thanks again, Doctor.
Grazie.